With flu season not far off, health officials are reminding pregnant women about the importance of a flu shot and the COVID vaccine. In tonight's Parenting and Pregnancy, sponsored by Women's Care, KEZI 9 News anchor Renee McCullough looks at the risks and benefits of vaccines.
We do recommend the flu vaccine. We've sort of forgotten about influenza last year.
Dr. Brant Cooper says we got a pass on influenza last year because so many of us were wearing masks and social distancing. But this year will likely be different, and he wants to make sure pregnant women are prepared.
1% of this regular population needs to be hospitalized every year with influenza. So for 100 people who get influenza, one gets hospitalized. But for pregnant women, it's about 10%.
The COVID vaccine is still a big talker during office visits. He says while a lot of his patients have been vaccinated, he continues to have conversations with others who are scared.
Some have not. Some are a little bit hesitant. I think that it's easy to be fearful when you're pregnant because you don't want anything to happen to your unborn baby. And there's a real, just deep feeling about that.
He says health officials are much more confident about the safety of the vaccine than just 6 months ago. And while there can be side effects from the vaccine,
they're real. Often within 12, 24 hours, maybe feel a little bit achy, need to take some Tylenol perhaps. And sometimes people even have a little bit of a low-grade fever.
He says they far outweigh the risk of getting COVID.
We've unfortunately seen a number of pregnant women who've gotten COVID, and some have been in the hospital. One was in the hospital for about a month. So really can get ill. The immune system doesn't work quite as hard when you're pregnant.
Plus, he says if you get the vaccine and still get COVID, your symptoms won't likely be as severe.
That was Renee McCullough reporting. Just this week, the American College of Obstetrics and Gynecologists and the Society for Maternal Fetal Medicine put out a message urging pregnant women to get vaccinated. The group cited the recent rise in cases and potential risk of severe complications if you get COVID. They say based on evidence from thousands of people who have gotten the vaccine while pregnant, it is safe.